topic of this podcast is post-surgery planning. Prior to entering the hospital for surgery, it is important to have a plan as to what you will do upon exiting. Discharge from the hospital after surgery seems to happen suddenly. Therefore, it is important to discuss discharge planning with a physician, assistant, nurse, and/or surgeon prior to entering the hospital to determine what will be needed at home or in the rehabilitation setting. It is important to ensure that the tools that a patient needs are readily available so that recovery and the rehabilitation setting are accommodating. A comfortable and well-planned and the recovery environment that is appropriate and properly set up can aid recovery. It is important to have home care instructions. Specifics like activity levels, diets, restrictions on bathing, and wound care all need to be discussed. A patient must understand that when he or she can return to work or school or resume driving. An individual recovering from surgery should also know what to do if signs of infection or worsening of condition occur. For example, patients need to know that or what to do if pain, fever, bleeding, difficulty breathing, or vomiting occur. Plan for any services that the patient may need, such as a family member being home or a need for a visiting nurse service should also be reviewed and handled prior to entering the hospital for surgery. It is important to have contact information readily available in case of emergency. Each surgery has unique home care needs associated with discharge after surgery. For example, individuals requiring hip surgery often require mobility products, bedroom and bathroom safety items like grab bars, raised toilet seats, and other toileting and bathing needs. Adaptive aids like hip kits are also often required because bending over are often discouraged. Hip kits include items like reachers, long shoe horns, and sock aids. These items are designed to assist in the dressing process so that individuals do not twist or bend injured joints. A schedule for physical therapy, occupational therapy, and rehabilitation may need to be established. A method to get to and from the physical therapy may need to be established if a patient cannot drive. After rehabilitation from knee surgery, individuals may require mobility aids like walkers, rollators, crutches, or specialty transport items or wheelchair. Other bedroom safety aids like raised toilet seats with rails, shower benches, or adjustable shower heads for bathing may be required. Foot surgery, like knee surgery and hip replacement, may have similar bathing and mobility requirements. In all surgeries where wounds occur, special instructions for wound care are important. Often, wounds require specific care. As mobility can be a challenge, individuals may want to plan to have easy access to their favorite activities prior to exiting the hospital. If a patient likes to read, watch TV, or listen to music, those items should be readily available in the rehabilitation setting. Proximity and accessibility to kitchen and bathroom aids may also be an important consideration. After surgery, individuals are often instructed not to get wounds wet after surgery for a period of time. In cases where bandaging and casting are necessary, individuals may need to wear an aqua cover over a bandage or cast to protect it from getting wet. It may be important to acquire wound care products and have a plan for things like changing bandages prior to committing to a voluntary procedure. Some wounds cannot be easily dressed in hard-to-reach places without assistance. It is important to have aids accessible when required. Each surgery is unique. Time frames for recovery may vary. Doctors' instructions can differ, and home care and rehabilitation requirements can be unique. It is important to think through each situation and plan to have a happy, healthy, and restful recovery. It is also extremely important to follow your physician's recommendations and consult a medical expert when complications occur or questions arise. For a complete transcript of this podcast, log on to medicalhealthsupply.com and click on Shop by Medical Condition at the top of the home screen.